Okay, recovering from an operation is stressful enough, but one of the scariest things that can happen is suddenly feeling short of breath. It's really alarming feeling, so let's break down what's actually going on when that happens.
So imagine you're on the road to recovery, and then suddenly you feel it, that tightness, that feeling that you just can't get enough air. It's a genuinely frightening moment. So what is your body trying to tell you, and why do medical teams spring into action so fast when this happens?
The first thing to really get is that being breathless after surgery isn't just some random isolated symptom. Think of it more like a very specific signal, a clear message that your body is sending up a flare. It's basically the body's smoke alarm. The alarm itself isn't the fire, right? But it's a loud, impossible to ignore warning that there's a problem somewhere that has to be found and fixed and fast. The whole goal is to figure out what's triggering that alarm. Now, here's where it gets really interesting. That single alarm, feeling breathless, almost always points to one of three very specific issues happening inside the body. This is how a medical team starts to zero in on the root cause. That's right, just three. By focusing on these three core problems, we can take a long, complicated list of medical conditions and make them way easier to understand. So let's dive into what they are. First up, we have hypoxia. This is the big one, the most common cause. It simply means your body's tissues aren't getting enough oxygen. The engine analogy is perfect here. Just like an engine sputters without enough air, your body's cells can't function properly without oxygen. Second on our list is acidosis. See, your body is obsessed with balance. It works incredibly hard to keep your blood pH in a super narrow, perfect range. Acidosis is what happens when your blood becomes too acidic, and that delicate chemical balance gets thrown completely out of whack. And our third alarm is hypercapnia. Now, this one isn't about not getting enough of the good stuff in, like oxygen. It's about not getting the bad stuff out. Carbon dioxide is a waste product from your cells, and if you aren't breathing effectively, it builds up in your blood to dangerous levels. Okay, so we've got our three main alarms: low oxygen, high acid, or high carbon dioxide. So the next logical question is, what's actually setting off these alarms? Let's connect the dots. This chart really lays it all out beautifully. On the left, under hypoxia, you can see all the things that physically stop your lungs from getting oxygen in. We're talking about things like pneumonia, a blood clot, or even a collapsed lung. In the middle column, acidosis is often tied to a body-wide infection called sepsis. And over on the right, hypercapnia gets triggered by things that slow your breathing way down, like the effects of sedation or a physical blockage in your airway. And here's a really important point. These categories aren't totally separate boxes. They can overlap. For instance, if your airway is blocked, it doesn't just cause CO2 to build up. Hello, hypercapnia. It also stops oxygen from getting in, which leads to severe hypoxia. It just goes to show how interconnected all these systems are. I know, hearing all those potential causes can sound pretty intimidating, but here's the good news. Because doctors understand these pathways so well, the response isn't chaos or panic. It's a very clear, structured, and systematic plan of action. This quote really says it all. The two keywords there are structured and urgent. This isn't about guessing. It's a well-rehearsed protocol designed to get the patient stable and find the root cause as quickly and safely as humanly possible. And that whole protocol really boils down to three logical stages. You start with immediate, life-saving actions, then you move into a rapid diagnosis phase, and finally, you finish with a treatment plan that's targeted to the specific problem. So step one is all about stabilizing the situation. Before you can figure out why the smoke alarm is blaring, you have to make sure everyone's okay. In the hospital, that means making sure the airway is open, getting the patient on oxygen right away, and calling for more expert help to get all hands on deck. Then the detective work kicks in. While the patient is being supported, the team does a super fast physical exam. They'll ask some key questions about the patient's history and the surgery, and then use all that info to order the right tests to confirm exactly which one of our culprits is to blame. And finally, we get to treatment, which actually has two goals that happen at the same time. The first goal is just supporting the patient's breathing. That could be something as simple as an oxygen mask or as complex as a ventilator. But at the same exact time, the second goal is to treat the underlying cause. So giving antibiotics for an infection, for instance. You support the system while you fix the root problem. Whew! Okay, so let's pull all of that together and just quickly recap the journey we've been on from that initial moment of fear to a place of real clarity. So if you remember anything, remember these four things. 1. Post-op breathlessness is a critical signal, not just a symptom. 2. It points to one of three core problems: low oxygen, high acid, or high CO2. 3. A whole bunch of different conditions can cause those problems. And 4, the most important part, there is a clear step-by-step plan to sort it all out.
And that's really why this all matters so much. When you're in the middle of a scary medical situation, seeing a whole team of people rushing around can be terrifying. But when you know there's a logical system behind it, a reason for every action, it can actually help turn that fear into a sense of understanding, maybe even empowerment. Because really, knowledge is the best tool we have for navigating these complex situations. It helps us make sense of the chaos. So we'd love to hear from you. What complex health topics should we break down and explain next?